I gathered all my supplies here. Okay, so I'm going to go ahead and go into the patient's room now. Knock, knock. Hello, my name is Bianca, and I'm going to be your nurse for today. Can you please tell me your name?
Matza.
Okay, and I'm just going to go ahead and perform hand hygiene, and that I'm ensuring patient privacy. Okay, and your date of birth as well?
August 10th, 1989.
Okay, I'm going to check the wristband, and I see that it's matching what I have on my form to do a second verification. Okay, so first I'm going to let the patient know what we're going to be doing today. We're going to be performing a head to toe assessment. We're going to be checking for cranial nerves. We're going to be doing range of motion. We're doing cardiac assessment, thoracic assessment, and range of motion, okay? So on a scale of 0 to 10, 0 no pain, 10 the worst pain, how would you rate your pain today?
A 0.
Okay, and I'm also going to ask the patient if she needs to use the restroom or have any urgency needs. Okay, and I'm going to now discuss with the patient the vital signs that we did were all within normal ranges. We did the blood pressure, we did the oxygen saturation, we did the heart rate, we did the respirations, we did the temperature, all within normal ranges, and I will make sure I document that at the end of this assessment. Okay, so now first I'm going to let the patient know that throughout the assessment we're going to be doing a skin integrity on each body system. Okay, so doing a general inspection, I see that the patient is sitting upright and she has good posture, good hygiene, no foul odors present. Okay, so first I'm going to do a head inspection. I'm going to palpate the head, making sure I don't feel any lumps or lesions on the head, and I'm going to check the sinuses, checking for any signs of inflammation. Okay, and nothing of that present. All right, now I'm going to move on and start and ask her if she knows where she is, if she's alert oriented. Okay, can you tell me what day it is?
Tuesday.
Can you tell me what time it is?
7.
Okay, do you know where you are?
Bedroom.
Okay, so patient is alert and oriented times 3. Okay, so now I'm going to move on to do the cranial nerves. First, I'm going to do cranial nerve number 1 and 2, 1 being olfactory, 2 being optic. Okay, so I'm going to ask you to cover one nostril, and I'm going to ask the patient what she smells.
Peppermint. Lavender.
Okay. Alright, so I'm going to go ahead and move on to cranial nerve number 2, which is the optic, checking for vision. The patient is nearsighted, so we're going to be performing the Rosenbaum vision test. So I'm going to ask the patient to hold it about 14 feet ahead and read the bottom line for me.
14 feet or inches?
Inches.
Warning, the upright position should be used only for a child that is at least 6 months old.
Okay, thank you. Alright, so cranial nerves 1 and 2 are intact. Now I'm going to be going forward to cranial nerves 3, 4, and 6. 3 being ocular motor, 4 being trochlear, 6 being abducens. Okay, first I'm going to assess that pupil dilation with my pen light. Look straight ahead for me. Look straight ahead for me. Okay, I'm going to check for accommodation. Alright, now we're going to check for eye movement. Okay, just follow the pen light for me. Okay, so cranial nerves 3, 4, and 6 are intact. Now we're going to move on to cranial nerves 5, 7, 8, and 11. 5 being trigeminal, 7 being facial, 8 being acoustic, and 11 being accessory. So I'm going to first ask the client to clench her teeth, and I'm going to feel the facial muscles. Okay. And now I'm going to apply a sharp or soft object on the patient's face, and she's to tell me what she feels and where.
Soft left cheek. Hard right cheek.
Okay. Gonna move to cranial nerve number 7. I want you to smile for me. Okay, frown, pierce your lips, puff your cheeks, wrinkle your eyebrows, wrinkle your forehead. Okay. So now I'm going to move to number 8, which is acoustic. I'm going to close one ear and I'm going to whisper and you tell me what you hear.
Cat. Dog.
Okay. All right. Now I'm going to move on to cranial nerve 11. I want you to shrug your shoulders for me. Okay. Move your head side to side. Okay. So cranial nerves 5, 7, 8, and 11 are intact. Now I'm going to move on to cranial nerves 9, 10, and 12. 9 being glossopharyngeal, 10 being vagus, and 12 being hypoglossal. This is checking for tongue movement, tongue strength, also assessing the lymph nodes and the carotid artery, okay? So I'm going to ask you to stick your tongue out for me. I'm going to place this tongue depressor. Ah. Okay, I want you to move your tongue out, side to side, up and down. Okay, now I'm looking to look for any oral thrush. You see any abnormalities in the mouth? Nothing seen. All right. Okay, let's see here. So that's fine. Okay, so cranial nerves 5, cranial nerves 9, 10, and 12 are intact. Alright, but first, before I continue, I also have to check the carotid artery, okay? Alright, so I'm just going to ask the patient to swallow. I'm looking behind the jawline, behind the ear, by the clavicle, just checking for any gross anomalies or abnormalities. Swallow for me, okay? Now, using my bell, I'm going to also take the carotid artery. I'm going to do one side at a time and ask the patient to hold her breath as I do it. Okay. Okay. So cranial nerves 9, 10, and 12 are intact. So now I'm going to move on to the upper extremity assessment. I'm going to first check for skin color, moisture, temperature, warm, dry, okay, even skin, all right. And now I'm going to also check for skin turgor, okay. I'm gonna pull here. It was less than 3 to 5 seconds, okay. So now I'm gonna also look at her skin or her finger refills, less than 3 seconds, capillary refills, okay. All right. Now we're gonna ask you to grip my fingers, okay. Pull. All right. Now I'm gonna ask you to flex your elbows for me, okay. The other one, okay. Now I want you to push down on your elbows, okay. Push, okay. Thank you. All right. So her strength is 5 out of 5 in the upper, and now I'm going to go ahead and do the abdominal assessment. Okay, I'm gonna ask you to lie back for me. Okay, thank you. And first, I'm going to just do a general inspection. The stomach is rounded, no distension. It's symmetrical. Okay. And now first, I'm going to auscultate. I'm going to first auscultate. You don't have to lift it up. I'm going to start with the right lower. Okay, right upper. Left upper. Left lower. Okay, so vowel sounds were present and noted and normal. Okay, now I'm going to percuss. Right lower, right upper, left upper, left lower. Now I'm going to lightly palpate each section. Okay, right lower, right upper, left upper, left lower. Okay. So vowel sounds are present, no abnormalities in the upper extremities or in the abdomen. Now I'm going to go ahead and ask you to, you can fix your chair back. Okay, now I'm going to go ahead and do the cardiac assessment. I'm going to be doing the 8 to man, listening to S1, S2, and I'm going to also be doing the anterior and then the posterior. Okay, the front will have 12, the back will have 16. Okay, and I'm going to ask the patient as she feels it to just breathe in and out as I do each. Okay? Aortic, pulmonic, Erb's point, tricuspid, and mitral. And here I'm going to count for 1 full minute, checking the apical pulse. Okay. Now I'm going to go ahead and check the heart sounds, doing the 12 anterior and then the 16 posterior. And again, breathe in and out once you feel the bell on your body. Realistically, you want to do it skin to skin, but today we're just going to keep her clothes on. And I'm going to avoid the sternum as I go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And when I do the posterior, I'm going to avoid the clavicle area. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Okay, so lung sounds were clear and they were easily heard, no abnormalities found there. Okay, so now I'm going to go ahead and move down to the lower extremities. First, I'm going to assess the skin, and I see that it is even, no signs of edema. Okay, the skin is even, warm, dry. Okay, all right. Now I'm going to ask you to, we're going to do some range of motion exercises. I'm going to ask you to lay back again. Okay, I'm going to ask you to bring your knee up and to the side, one at a time, to the side, up, all the way up to the side. Okay, and the other one. Okay, now I want you to rotate your ankle for me. Okay, I want you to invert and evert your ankle. Okay, the other one. Okay, all right. And I just want to really quickly do the abduct and adduct for our upper extremities. Okay, so I want you to abduct for me, bring your arms away from your body. Okay, now I want you to bring them back to your body. Okay, okay. Now I want you to press against my hands for resistance. Push. Okay, this way. Okay, great. So strength there is 5 out of 5. You can lower your chair. All right, so now I'm going to ask the patient to stand up and walk toward me. We're going to test for gait. Okay, walk to me. Okay, walk backward, turn around and walk the other way. Okay, so steady gait. Now I want you to turn around. Okay. Okay, sit down for a second. Okay, now stand up. We're going to do the Romberg test. Close your eyes for 20 seconds. Okay, I'm going to push and see the patient's moving side to side. All right, okay, you can have a seat. Okay, so we are done with the head to toe assessment. All body systems were checked, no abnormalities found. I'm going to document